And I would like to announce that prayer today will be by David Weiland, the Pledge of Allegiance by John Clark, four-way test by Bill Ralston, and song by David Ellis. If everybody would please rise.
Join me in prayer. Father, we just come to you now grateful for all of our blessings. Father, we just pray for this Rotary Club specifically and Rotary International generally, for all the work that they do, and for the motto of service above self surely is what we desire. We thank you for all of our blessings, and we thank you for this food, and just ask that you join us presiding over this meeting. In Jesus' name I pray. Amen.
Join me in the pledge. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Please join me in the four-way test of things we think, say, or do. First,
is it the truth?
Second,
is it fair to all concerned?
Third,
will it build goodwill and better friendships?
And fourth,
will it be beneficial to all concerned?
All right, open up your blue book. Song number 6. Number 6. It's a new song. It's called America the Beautiful. Y'all ready? Me. Okay, here we go. Oh, beautiful for spacious skies, for amber waves of grain, for purple mountains' majesty, above the fruited plain. America, America, God shed his grace on thee, and crown thy good with brotherhood, from sea to shining sea.
Good one. That sounded great. That was amazing. Okay. We must have a very interesting program today because we have 2 Daybreak Rotarians here. Rose Hayden, who is going to actually be introducing our speaker today. And we have Jim Satterwhite, Daybreak Rotarians visiting. We have 2 guests. Tracy Fenton, will you please announce who your guest is today?
I have Eleanor Hill with me today, my daughter, for those who don't know.
Who is a very sharp young lady and is learning a lot about leadership.
Yes, ma'am. Thank you to you and your book.
No, you are just learning from everybody, I can tell. David Weiland.
My guest today is Jenny Murdoch. Jenny is here representing the Christian Motorcycle Association. That's another group that we can't put on the Cotton Pass Challenge without. They have at least 2 motorcycles, one leading, one following every route that we've got on the Cotton Pass Challenge. And I'm so glad for their continued participation and assistance in this.
And he has a really cool strike. His wife's strike. Okay, still really cool. All right, cool. Let's get right on to Happy Bugs. Yes, sir?
I have a guess.
You do have a guest. Gail, how did we overlook you? You did not get on the list.
This is my lovely wife, Gail Ralston. She's our guest today.
Yes. We are fond of her being a guest here. Oh my goodness gracious. All these guests. Yes, please.
I can't call him an old friend because he's younger than I am, but I'll just say it's a long-time good friend, Dale Waters, retired game warden.
All right. Anybody else?
Anybody else?
Another class. Okay. Oh, we got money already.
All right.
Here. All right.
I want you to know that we just went over $500 for our deck of destiny. So maybe it's destined for you today.
I'm happy today. It's kind of a bittersweet, but Karen Thomason just went in and had her gallbladder removed. And she was in hospital for a few days, but I hear she's in her room and they're going to let her go home today. So that is a happy day.
Very good. Liz, you got something for us?
Debbie.
Well, I'm happy, and I apologize for not being your greeter. I didn't get here in time. But welcome, everybody. If I didn't greet you personally, you're welcome to Rotary. And welcome to Rotary. And so I want to welcome Dr. Thomas and his wife, Donna, who'll be speaking in our guest. So anyway, thank you.
All right, Lonnie.
I'm happy because this Friday night begins, excuse me, this Friday night begins the Greenville High School Lions football season. And we have something, a long tradition of broadcasting the Lions games to the community. And I'm proud that we're continuing to do that again this year. We have a broadcast team that we hire every year that does that. And we sell ads for the broadcasts that to be aired on the radio station. And there's as little as $25 a week to have your 30-second ad on there. It doesn't go to the radio station. We're just doing this to cover the cost of the broadcast team. So if you have a business and you would like to help support the Greenville Lions football broadcast on the radio station, please see me. I'd be happy to talk to you about it.
Thank you. This side of the room. Oh, here we go.
Corey's going on vacation with 10 or 12 of her friends to the Gulf Coast, and I can't take. I don't know who's happier, her or me.
All right, working in the middle there.
Well, I had a new experience. I got diagnosed with melanoma cancer back in June, and I'm going through treatment now and getting some very good reports and doing very well for what I'm thinking. So I'm going to consider that a praise. And I have time.
I'm happy that I had my 40th wedding anniversary last Sunday, so we're going for 41 next time.
All right, right in the middle.
I'm just happy.
Happy girl over here. All right, John.
This is a happy buck on behalf of CASA and our president, Katie. One of the endeavors that we've done at CASA is create 2 videos, one for volunteers and one for giving at CASA. And one of the interviewees that we have give a testimonial of the value of that was Katie. And you came through loud and clear. You did a fantastic job in presenting the needs that CASA has and your support for it. I just
Not
thank
just
you,
mine,
Katie.
all of Rotary.
All
I
of
spoke
Rotary.
for our
But
Rotary Club.
you spoke for you too, and we appreciate that so much. You did a nice job.
All right, moving across the room. Moving over here. He's happy.
Put a couple bucks in there.
Larry, you're
And I'm
wrong.
always happy. Always happy.
He's still retired.
You're in the wrong chair. You
Hey
know that.
man, I'm still retired.
This is my good friend Jim Satterwhite, and he just lost his mother this week, and they're going to have the funeral for him today. Is that right?
That'll be tomorrow after 1 o'clock at Lynch Funeral Service.
Okay.
Whoa.
So on the Cotton Patch Challenge Facebook page, we've started featuring the sponsor photos. So these are the sponsors who have helped sponsor our event. And one of the biggest advantages they get out of that sponsorship is name recognition and us thanking them continually for that. So make sure you're following the Cotton Patch Challenge page. Every time you see one of those sponsor photos, make sure you like it, make sure you share it. And of course, if you happen to go to one of those businesses, make sure you mention, thank them for sponsoring the Cotton Patch Challenge.
Thanks, Chris.
Just happy?
I'm not allowed to.
Okay, another Cotton Patch Challenge announcement. Volunteer sheets, okay? So these are going around today. Please volunteer. We need a lot of people to pull this off. This is a huge, huge endeavor for the club. So we need all the help we can get. So please, if you have any questions about any of the categories, about what you can volunteer for, please let us know. But So sorry about that, but that's the way that works. And but you also get off early for some of them. So there you go. So anyway, I'm going to start this around. So please take time. Please volunteer. Thanks.
And Tim, you just mentioned something. There are individual information about what each job is, correct? So that you're not just signing up for something and have no idea what it is. Kind of like when David Weiland came up to me the first year and said, "Can you work SAG?" And I went, "Sure." Don't know what that is, but sure, I'll do it. So this way you'll know exactly what you're being asked to do and what the responsibility is for that chore.
The first year you learned how to park.
I did, but I also was asked after that to work SAG, so maybe I didn't do such a good job parking. I don't know.
I need to ask him, where is everything gonna be picked up at this year? Because I know
we still have the garage this year.
Okay.
So we still have the garage this year. So yeah, and that's on top of everything else, I am in charge of the setup, and Link and I will be there bright and early, and we'll get everything out and everything set up.
Usually that was on Friday night, but we're gonna be able to do that?
Yes, yes.
As usual, we hope.
Yes, and I do have a breakdown on the supply gathering and stuff, the days and the times and stuff like that. So any questions you have about that, let me know. I guess that's my cue to get off.
I know, I see more money back there.
All right, Gary, you're up.
Well, let's see if I can compete with the program. Okay, well, my happy buck is I'm happy to be here. I had a wonderful visit with two of my siblings, both much younger. My sister had just gotten over 3 discs fused in her neck and was able to close her hand for the first time in 6 months. So that was exciting. That happened at Galveston at the Big City Hospital. Then my brother, who had 2 discs fused in his lower back, 3 months ago, was up walking, greeting me, and talking. So I'm very thankful for those surgeons. I'm happy to be here. And like Liz, I apologize for missing greeting as well. Here's my daughter.
All right, sweet Roxanne.
I'm happy that David had a happy birthday this week. And I'm happy it rained.
Hey.
Jim, you want to say something? Say anything? No? You good? Larry.
Anybody else?
Larry.
All right, I want to say the upcoming Relay for Life, September 14th. I want to give a special big shout out to Van Sickle Baptist Church, the parishioners, David Weiland and his group. Fantastic serving meals to caregivers and survivors. We all appreciate it. Thank y'all so much.
Tracy Fenton has a new arrival.
This is our other guest. This is Kiara Campos, who's Joey's work colleague with Nissan of Greenville as the owner loyalty manager there.
Y'all did a good room there, huh? It's magic.
Our daughter was there.
All right, we're over $500 for the Deck of Destiny. So let's draw. Where's my cards? They're up here. Kami, can you hold this for a second?
That's Kami. All right. Well, while he's doing that, I'm actually going to do a couple of announcements very quickly while he's setting that up. I want to remind everybody that Thursday night, tomorrow night, at Ash and Rose from 6 to 8 is our Pines for Polio event. I want everybody there. If you have ordered a t-shirt, the End Polio Now shirts, I have those. If you didn't already pick them up, you had to have ordered one for me to have them in the box down here. But more importantly, even if you didn't order one, I need you to show up that night, tomorrow night, because we are going to be basically asking for donations, monetary donations. We'll also get 10% of the food sales all day long is being donated to us. So anybody tomorrow night while we're there that chooses to donate, we're also going to be slapping stickers on their shirt. It's kind of like a I voted. It's a I gave to the End Polio Now campaign. So this is going to be really cool. I'm super excited about it. So please make sure to come out and help us. with this event, and make sure also you, your spouse, your office, go and eat at Ash and Rose at lunch tomorrow.
Okay, Rose, would you pick a ticket for us and holler out the numbers?
347 4 9 2.
There we go. All right.
Ronnie. I think John's feeling lucky over there. Come on.
All right, let me see it, John. Let me see it.
Okay. Okay.
Hey, I was a Boy Scout. I was on it.
Wrong one.
It's close.
It's close.
It's a spade, but it's a 5. So we're gonna trash this one. And
Troy, you want to come up and speak? Troy needs to talk about the haunted landmark for 1 minute. The next person that has
1 minute.
a minute is Liz. She has something we will be doing as well.
So we're continuing to work every Monday night at 5:30 right below us in the Haunted Landmark, getting ready for that. Coming up, we're going to be doing some shoring up of some of the mazes with putting more supports on top. So if you are carpentry minded, we need your help this next week. We've gotten a lot of cleaning done, a lot of upkeep done, but just have a few things to take care of. I also need somebody to help out with some basic supplies, batteries. So if you are in the position to help donate some batteries, come talk to me or raise your hand now. And I also need a group of people to help with doing some tweaks and updating the jail, the graveyard, and the exit room, the last 3 parts of the attraction. So, looking around, I see a lot of enthusiasm with what I've said, so thank you. I appreciate the support. It's always good to get that positive vibe back. Anyway, if you can help me with that, that'd be great, and it'll go for scholarships towards the kids this year, so appreciate you.
What kind of batteries?
Batteries, we need AAAs, a pack of 36 and 9 volts, pack of 4. 36 AAAs and 4 9 volts. Cool. Okay.
I already
Anyway,
bought 100
all right.
3-volt.
Here you go, Liz.
If y'all remember last year, our office did a cause campaign for FISH, the Meals at Risk Kids. We did the PB&J. So we are going to do that again this month. So we asked everyone to bring a jar of peanut butter and jelly every meeting, or stop by my office and drop it off. We're going to be collecting, and I'll be collecting all those jars. We were very successful last year. We had a lot of jars that we took to FISH. And so if y'all would bring them by our office or bring them up here to the meeting, we're not going to meet the week of rally, right?
Of the bike ride.
Right. So, but we are meeting next week.
Yes.
Okay, so yeah. And I will hand out flyers, and I'll put it on Facebook and the chamber page. So join us for the PB&J campaign for the Meals at Risk Kids. Thanks.
Thank you, Liz.
Okay, I would like to invite, where there he is, if Chief Powell would come up. So, I don't know if you guys remember, I remember it vividly, talking about the pumper truck, right? We didn't know what to call it, so I called it that. Okay, perfect. I made up my own word, whatever. So, when he came to do his presentation and he was talking about the truck, it was a 1948 pumper truck that they wanted to restore, and were asking for assistance and donations in making that happen. And very quickly afterwards, the board met and decided, yes, we wanted to get involved in that. And so I wanted to make sure today that I am announcing we are going to give you $500 towards the restoration of the pumper truck, which I'm thankful that was the actual term, because I put it on the check. So we will be giving you the actual real check here in just a minute. But wait, there's more. So shortly after you came to do your presentation, miraculously this page showed up at my office that talks about the fire prevention program and asking for a donation to the fire prevention program. I wasn't sure if you physically delivered it all on your own, like, ooh, well, she's a sucker, I'll take that. But I thought, you know, after hearing everything that you do and how remarkable it is and how much good it does for our community, I said, my company, Cornerstone Insurance, is definitely going to be a part of this. We're definitely going to sponsor. So I am also giving you a $100 check from Cornerstone Insurance for the fire prevention program. And what I'm going to encourage everybody in here to do is to go ahead and match that, or even more. There's multiple levels of sponsorship for this program. So there's plenty of you in here that can do this and can match this, or do your own level. But I want to make sure that this gets done today, and that not only as, you know, Rotary and giving you the $500, but Cornerstone is also going to give you $100.
Thank you so much.
Yes.
Appreciate it. Thank y'all very much.
Okay, that's it for the announcement until the end. I will announce a couple of things at the end. So I would like to invite Rose. Would you please come up and announce your program guest today?
Thank you. I'm Rose Hayden with Hunt Regional Healthcare, and I see a lot of friends in the audience, so I'm happy to be here. Thank you for having me. And I want to first say that really due to the dedication of our leadership, CEO Richard Carter, and our hospital board, we've been able to bring new services and new medical staff to Hunt Regional Healthcare to really expand the availability and options for our community. And we really appreciate that. We're excited about that. It's a great time to be with Hunt Regional Healthcare. I want to run through just a few things that we've added in the last 6 months. First of all, you may know that in February we added 3D mammography with iCAD AI technology. Now 3D mammography has been around for a few years, but really insurance and Medicare did not cover that. That did not make sense for this area to say, hey, we're going to charge you out of pocket. Once Medicare covered that, we said, let's bring that to our citizens. So especially those ladies that maybe their specific breast density, or they've had past callbacks, really that makes a difference to them. And that iCAD technology, we're the only ones in this area that have that new version, and it really helps the reading. So anything we can do to detect breast cancer early is a good thing that truly does save lives. We also added Dr. Christopher Witherspoon. You've met him. He's been here to speak. He's family practice and primary care sports medicine with our Hunt Regional Medical Partners group. And recently we added Dr. Selvaggi and their team in Live Oak in Commerce. So they just came on board this month. We're very excited to add them to our repertoire of family practice and our physicians. But today we're here to talk about Stryker Mako, and you may have seen advertising about it, and we're very excited to bring this on. It's a robotic arm that assists the surgeon during total and partial knee replacements, and this benefit really adds to the patients with less pain, which means less need for pain medication, less time in the hospital, so you get discharged earlier, and less need for inpatient physical therapy. So we're excited to have that here. I'm going to show you a short video, and obviously I am not a surgeon, so I'm so excited that Dr. Thomas and Stacy Stevens graciously, thankfully, agreed to be here to answer any questions regarding knee replacement surgery. So I'll introduce them after the video. It's just about 3 minutes. Hopefully we have music. I think we worked on that. So. See, I tried to avoid that. There we go. It must be a great video. We're trying so hard to get this up for you.
Our knees are the largest joints in our bodies. They're central to almost everything we do. So if you or a loved one suffering from arthritis or an injury to the knee, everyday activities such as walking, sitting, or kneeling can feel debilitating. But you're not alone. It's one of the nation's most common causes of disability and impacts the lives of 54 million people in the United States alone. One possible treatment option for knee pain is total knee replacement, a procedure that involves removing the damaged bone and cartilage, then replacing the knee joint with an implant to reduce pain and restore the motion and function of the knee. Today, knee replacement surgeries are being combined with a new technology, and it's changing the way knee pain sufferers are treated. Meet Mako, a robotic arm-assisted technology used by surgeons to perform total knee replacements. This unique technology helps surgeons provide a personalized surgical experience, where each surgical plan is based on a patient-specific diagnosis and anatomy. And in the laboratory study, Mako Total Knee enabled surgeons to execute their plans more accurately, while also protecting soft tissue and ligaments from damage. Let's take a look at how it works. It begins with a CT scan of the knee joint. A CT scan is a series of x-rays taken at different angles that can help surgeons see things that they can't typically see with an x-ray alone. The CT scan data is used to generate a 3D virtual model of the patient's unique anatomy. This virtual model is loaded into the Mako system software and is used to create the personalized preoperative plan. Prior to surgery, the surgeon reviews the plan size and placement of the implant, and if necessary, modifies the preoperative plan in order to better position the implant to the patient's unique anatomy. During surgery, the surgeon locates points on the knee in order to register the anatomy in the Mako system. This process establishes the relationship between the patient's actual anatomy in the operating room and the 3D model that was used during the planning process. This step helps ensure the procedure is executed to plan. Once the anatomy is registered to the 3D model, the surgeon has the flexibility to modify the preoperative plan based on their assessment of the patient's anatomy and range of motion. Then, the surgeon guides the robotic arm to remove the arthritic bone and cartilage from the knee. A virtual boundary provides tactile resistance to prevent the surgeon from removing more than just the arthritic bone identified in the preoperative plan. And visual cues, shown in green, appear on screen to show how much bone to remove. Collectively, these cues help the surgeon stay on the preoperative surgical plan. With the diseased bone gone, a knee implant is inserted into the joint space, and once the surgeon is comfortable with the knee's movement, it's off to the recovery room to begin the journey towards strengthening the knee joint.
There's like a minute of music so you can read all the legal jargon at the end, right? So we're very excited about this. This is a great opportunity for our community. If you've never seen what $1 million looks like, you can check out our machine. I'll tell you when and where. This is an example replica. It's only about, I'd say 60 to 70% to scale, but that gives you an idea up close. I'd like to, at this time, introduce Dr. Jack Thomas. And Dr. Jack Thomas established Greenville Orthopedic in 2001. He is a board-certified orthopedic surgeon for over 30 years of experience and treats a variety of orthopedic conditions and problems. Dr. Thomas has been trained by Stryker to use the Mako. Thank you. And also Stacy Stevens, who is our director of the Surgical Center at Ham Regional Medical Partners. Dr. Thomas, would you like to say a few words?
Absolutely.
Thank you for having me. Stacy, what kind of music does a robot listen to?
I guess it depends on the surgeon.
Heavy metal. Silly joke for a serious you did it perfectly. Thank you very much. Silly joke for a very serious topic. This is a game changer in terms of orthopedic knee surgery for us. It doesn't replace the surgeon. The surgeon is still doing the operation. It simply guides us so that we can do it more precisely. Dr. David Liao, my colleague, and myself have been trained and certified in the use of the robot for knee surgery, and we found that it produces a superior patient result. Sometimes it's confusing when you see these cardboard models. Stryker is actually the name of the company. that makes this. It's a large orthopedic company in actually the world, and they produce excellent products. Mako, as you may well notice, there's a Mako shark, and I think that probably they got the name from the way it would cut through the bone so easily. So don't let that put you off. It's just their make, their name for it. The robot, it is a robot, but it's controlled by a surgeon. In this model, our cardboard, you see, there's actually, it doesn't depict the saw, but there's actually a handle on that saw, and the surgeon controls that. The robot and the software actually guides the cuts as they're made into the bone. And you may be thinking, why are you making cuts in the bone? What's that all about? Well, what hurts in a knee is the bone rubbing on the bone, exposed nerve endings. So what you do is you go in and you don't cut out the whole knee, you simply shave off the surfaces of the knee and then put metal and plastic components in the knee that resemble the actual surfaces of a real knee. And that works like a real knee, but because they're metal and plastic, there's no nerve ending. So it relieves the pain and yet reestablishes the function. And what the robot does is it helps us as surgeons make more precise bone cuts. That's really all it does. And it does it in such a manner that there's less bleeding, less soft tissue damage, and a quicker recovery with less pain. It's a really big deal having the robot here because it's very high tech and it's very expensive. And Dr. Leal and I both appreciate the efforts Rich Carter's made in getting that here for us to use. I'd love to entertain any questions you might have. Yes, sir.
If you could, you've probably worked on a couple of famous knees, but is there a couple of folks that you can tell us that we might know that have had a little work done?
No, they can't.
No, unfortunately, they become a federal law.
I don't know if you could brag about any of the football players. So you can,
oh, I'd love to tell you everybody's name. There might even be some people in this room, but I'm not supposed to.
Lonnie's not very famous.
If you'd like to stand.
Yes, ma'am.
It looks like you're. Where's the patient in this? Are they up here?
No, the patient's on an operating room table, and that you roll the machine up beside the operating room table, and you cover it with a plastic drape. And you got to remember the actual machine is much bigger, probably twice the size. And this shows really a burr, which is used in another type of knee surgery. You really have a handle with a saw in it. You saw it in the video there. And this is an articulated arm that moves.
So it just goes all the way down.
So you can move the arm up, position it over the knee, press your trigger button, and then the computer actually lines up the saw with where you're supposed to make the cut. That's what's the most ingenious thing about it. The surgeon is still controlling the saw. It's his judgment controlling generally where the cuts are made, but the computer and the robot itself help us precisely make the cuts where you've planned to make the cuts before the surgery on the computer.
So you're operating with like a joystick or something?
Well, you actually have a saw, like in a grip in your hand that you position over the knee, press the button, and the computer has been linked to the knee already, puts the saw right on where it's supposed to cut.
Sounds interesting.
It is very interesting. Orthopedic surgeons love gadgets, and we love to operate, and Dr. Lee and I both think this is one of the greatest things we've ever had here at this hospital. Yes, sir.
How much shorter is recovery time with using this machine as opposed to?
Probably about 20%, 20-25% less, than what I've seen.
Are there other surgeries or other parts of the anatomy that you use this same machine on?
Yes, you can do a partial knee replacement with this, where you replace only half the knee, or the full knee, which is known as a total knee. And there's also an application for this doing hip replacement.
Mm-hmm.
Yes, sir.
I just want to do a shout out to my hometown, Kalamazoo, Michigan, the borders of Stryker.
That's absolutely correct. Their home base.
What What are the common indicators for a knee? Why do you need a knee replacement?
Pain, number one, pain and deformity. But it can't be in, Richard, can't be in a young person. We're trying to avoid it less than 50 for sure. Really like 60 or more. There are indications for it in the 50s. And someone who's had conservative treatment already, has had medication like oral anti-inflammatory medication, an exercise program, maybe some injections in the knee with steroid or the joint fluid therapy. We try bracing, we try, all of these things before we get to surgery of any type. But when you've exhausted this conservative treatment and you've got x-ray findings or bone on bone, that's a pretty good indication. Again, if the patient is able to withstand the operation. Or some people just have, because of age and heart disease and diabetes, are just too sick to have the operation. But 90% of the people are capable of undergoing it. Yes?
What can a person do to prevent or help yourselves to maybe not have?
Great.
Not play
Number
volleyball.
one, weight loss. Maintaining optimum body weight. That is a really important factor. And some of the things are like, knee injuries. You say avoid knee injury, no one's going to go out and have one on purpose, but injuries to the joint accelerate the deterioration. But also the big thing that I see is weight loss.
Sports?
Well, you don't want to avoid sports, but you certainly want to be conditioned for them and take care of yourself during those things.
So if you get on your hands and knees and you mop that floor, if you got to scrub something on that, does that hurt your knees? Does that damage your knees?
Do you want the doctor accept
that really is going to make you sore, but that's not really what causes arthritis. A lot of it's familial in nature too. Grandma and grandpa had it. You're probably going to have some of it too. But it's related to prior injuries and then also to body weight. Yes, sir.
We just got the machine that was activated on July 1st. How many knees have been replaced using our machine so far?
The Mako?
Yeah.
Yeah, I think probably in the hospital here, 4 or 5. And Dr. Liao's been doing them for a year over in McKinney. So it's been done a lot. It's been over the last several years, there are a lot of these knees that are being done. And the results are really pretty good. Yes, sir?
ISA or leasing?
I'm not sure.
That's a rich question.
That's beyond my pay grade.
He's on loan.
I do know it's expensive as heck, and we're very, very happy and very privileged to have it here.
You mentioned just a moment ago diabetes. How does diabetes affect the possibility of total knee replacement?
Well, it really depends on how well you are, what your health level is.
Okay.
In other words, if you've got
whether or
really,
not you can have a surgery.
yes, exactly. If you got a brittle,
I
you're a
was
brittle
trying to
diabetes.
relate the diabetes to the poor knee condition. I didn't understand that one.
No, if you've got really bad diabetes, it's going to affect your healing and susceptibility to infection in those kind of things. Yes, sir, back there.
I've heard over in Europe there was a movement toward resurfacing versus joint replacement. Have you heard any of that where they, instead of a total hip, they just do resurfacing or
Yes.
this and that?
And I trained in that 10 years ago, and unfortunately, most of them have failed.
Really?
And that's the reason why they don't do them anymore. Rich?
How long does a new knee last?
20 years. Unless there are other, that's a stock answer to say, because that's basically how long you're going to have before it either loosens or the ligaments loosen up. They can be longer than that. I've seen them 30, 35 years, but you're doing them on people later in life, in their 50s or 60s, so you figure, you buy 20 years, by their 80s, they're going to have a very decreased, functional capacity. They're not going to wear it out and do much to it. But again, you can have injuries, you can have infection along the way that can shorten the lifespan of a total knee, unfortunately. And also that weight plays a lot of that get also. Yes, sir.
I'm gonna give you a little plug here. Dr. Liao replaced my left knee about 6 years ago, and it's been great.
That's great. And that was before the robot.
Yeah.
So it's just going to show you, Dr. Liao and I have been replacing knees for decades, and they do great. But they do very well. With this, they do great.
I had a previous injury back when I was a child, and I broke both my legs. They put a nail in that knee, or in that leg.
Yeah.
And Dr. Layout proceeded to tell me how much trouble he had getting around the end of that nail to put that knee replacement.
Yeah, you got to cut around the end of it.
Yeah, he had to work around it to make
But
sure it all.
that's an example of a prior injury that contributed to that thing wearing out so quick.
Yeah, I agree.
Thank you all very much. Appreciate it.
He did a wonderful job. He did a much better job than I could have ever tried to do, so I appreciate him coming and spending time with us. I also want to give a shout out to Stacy Stevens. ROR actually has a very low infection rate. We do win awards for that, so we're very proud of that fact. If you want to see the Mako in person, the real deal, not just a cardboard cutout, December 3rd, mark your calendar, we are hosting the Greenville Chamber of Commerce Business Before Hours. So we'll have food, we'll have some drink, but we'll also allow you to see this in real life, so please come. And thank you so much for having us. We really appreciate that. Thank you, guys.
Thank you. All right. I really appreciate y'all being here. And this is all very interesting information, especially because my husband just had double knee replacement surgery, 2 at one time. That was fun. And I am due for one because I've had 5 knee surgeries already and it's thrown everything off. So definitely, I'm excited to hear that this robot is here because my husband was not able to have the robot surgery. So that's gonna make much better operations for people of Button County. Okay, I have still 2 announcements quickly to make. The first one is on your table you have service logs. Please make sure to fill out any service that you've done. And I know there are several of us in here who have been down in the Haunted Landmark working their little heinies off. I know that there's a ton of people working on the bike ride. We've got chamber people. I mean, Roxanne, the Lake Tawakoni Regional Chamber of Commerce counts. So that's a service. We've got Altruisans in here. We've got all kinds of folks in here that we really need to show all of our service that we do. We've got an upcoming president of the chamber sitting amongst us. So please make sure to mark that on your service flyer, the service sheets right there. The second thing I want to announce, and this is big, and this is why I waited until the very end. On your calendar, it says we are not meeting next week. But that is not correct. We are meeting next week. Please make sure to be here next week. We've got a lot of things to talk about. We're going to have a club assembly, and the following week, our governor will be here, our district governor. So please make sure to be here, and let's talk about our club next week, and we will have the opportunity for people to make announcements.
And we aren't having a meeting on the 18th?
We need a meeting on the 18th.
We're not talking about that right now. We are meeting next week.
Right.
Is as far as I can go right now. Yes, sir. The sign-up sheets for the bike ride, where did it go? Tracy Fenton has it. Please hustle right over there as soon as the meeting is over, and please go and sign up for 1 or 2 jobs. I think at this point I have 3 jobs. I don't know.
CPC meeting after.
Cotton Patch Challenge meeting after this in the boardroom. All right, if that is all, that is Rotary for the day. Thank you.
This video has been brought to you by Juice 34. Juice is your community-owned provider for electric, internet, cable TV, and true local programming.